We know there are challenges for employers in the market. From market trends to interviews with industry leaders, let us be your trusted advisor as we explore the Benefit Summary, presented by Genesis Health, with your host, Matt Monahan.
All right, Guy. Thanks for being here. I appreciate you making the 3-block trip uptown.
Yeah, great to be here. It was an easy commute.
It's funny, when my commute to Atlanta, I say the same thing. Like, coming across town on 38th Street, it feels like what I was doing back in, 2016.
Yeah.
It's fantastic. You and I have known each other pretty well. I would love to give the audience a chance to learn a little about you, if you don't mind, sharing a little about yourself.
Sure, yeah. I'm originally from Israel, grew up there. The youngest of 4 brothers. Then at 18, joined the military in Israel, like most people do. Ended up staying for about 14 years. I was a fighter pilot, flew F-16s for about 12 years. Last role was squadron deputy commander in the Israeli Air Force, which was great. Then kind of left that, wasn't that exciting, so came here to the U.S., went to Yale to get my MBA, and then worked at McKinsey, the consulting firm, for about 7 years here in New York. Did mostly digital and analytics. And while I was at McKinsey, I kind of always thought about when is the right time to start something of my own, and realized kind of the opportunity in this space. So that's when I left about a year and a half ago.
When you're at McKinsey, because you're doing, you're evaluating different companies and you're looking under the hood, and do you get some really interesting insight on where the problems are, or
Super, super interesting. It's amazing to see where some of the problems, they're really across the board. Every company you'll see the same problems, but some problems are just very unique to that situations. And I've worked with companies in the media space and in communication and even industrials, all across the board. And yeah, you go in and you really, really see the problems. I have a really good friend who has a restaurant, and he says that, every guest that comes in, they'll see the crack on the wall. But if he's there every day, he won't see it because he's used to it. And I think that's exactly what you'd see at consulting firms and at McKinsey, is that you go into this company and you see something that's so obvious, but everybody's been doing it. So they are not seeing it as a problem. So definitely you get a lot of insights from that.
So was it through your time at McKinsey, did you work on a project that was healthcare related that kind of gave you some insight, or what drove you into developing a product that's going to be focused towards the one of many healthcare problems?
Yeah, it's a good question. So I didn't do any healthcare at McKinsey, but I did do a lot of work on bringing digitization to processes that are not digital, and a lot, right? And when I thought about my experience and where are there opportunities to be more digital, healthcare was obvious, because I couldn't wrap my head around the fact that every time I have a question about my healthcare, I have to go to an HR representative, and they send me to a call center. And then I have to wait on the phone for sometimes an hour to get an answer that sometimes isn't even accurate. And it got me thinking where, I remember when I was much younger, I would go with my dad to the bank to see how much money he has in his account or talk to the teller there. Now nobody does that, right? It's all on our phone. But we're still calling call centers. We're still going to HRs with questions. We're still emailing HR, hey, what am I covered for anxiety, which doesn't really make sense. Why would somebody have to tell HR that they have anxiety, right? It should be something that's very personal. So it just got me thinking, hey, I'm doing all these things on digitization in other worlds. Why can I bring the same tactics, the same methodology to the world of healthcare? And as I looked even deeper, because at first I thought, well, maybe it's because I'm an immigrant and I don't really know the U.S. healthcare system, so that's why I'm struggling. But when I talk to my friends at McKinsey or my friends from school, they would all say the same thing. We don't know what we're covered for. We don't know how much it's going to cost. We get bills that we're unsure why we're getting them. And there's benefits that we don't even know about that we're covered for that we're not using. So I realized that it's a huge issue. And I think especially with digitization and AI and the technology that we have today, it's exactly what we need in healthcare.
Yeah, and it's funny because your family could have come over on the Mayflower and it would still be the same question.
Exactly. Yeah.
I think that's what makes this so confusing. And that's what's made the conversations that we've had over the last couple of weeks, and what I was really excited about today was to just really kind of dive into how you got to here. And, one of the things that I have truly found interesting is that this type of solution that you have built, and I think we should start with like what you built because I don't want to get too far into this and be like, what the hell are they talking about? So let's jump into like walking everybody through what Healthee is, and just kind of bring them up to speed so we can provide some context to the conversation.
Yeah. No, definitely. So what we built is basically you can think about it as a personal health assistant, an AI-driven virtual personal health assistant. We call her Zoe. And what Zoe knows how to do is completely transform your healthcare experience. If it's until today it was inaccessible, complicated, hard to reach, now with Zoe, it's all accessible. And the way she works is she can take any health plan. So it doesn't matter if you have Blue Cross Blue Shield, United, Cigna, any of the 900 carriers out there. She'll take those health plans, which, as you know, are hundreds of pages that nobody reads and that changes every year. Mm-hmm. And she'll basically transform them from an unstructured data source, which is just a nicer way to say a PDF, to a mapped database. And once she does that, she also takes all your other health benefits from your employer, like fertility, mental health, even your dietitian benefits or gym membership. She'll put them in the same database, and then she can answer any question about your health benefits. So imagine if you have a Zoe, you can go to her and say, hey, my daughter needs a speech therapist. Am I covered for it? Where can I get it done? How much will it cost me? Book me an appointment, all within 30 seconds without talking to a single person. And she's also proactive, so she'll reach out to you and say, hey, Matt, it's time to get your yearly physical, or mammogram for women, or vaccination for your kids. So again, that concept of a personal health assistant, something that doesn't exist today, that's exactly what we built.
Yep, and the directional component of it, I think, is worth noting, right? So I could go in and say, hey, Zoe, I have this issue. It would narrow down, what the issue could potentially, well, to some degree, like what the issue could potentially be, what kind of doctor I would potentially want to see, and the cost that doctor would charge, right?
Exactly. We'll give you your options, right? So today, users or employees or members, they have to go to 5 different platforms to different things, right? Maybe your carrier or calling your carrier for you're covered, then going on a different platform to figure out if your doctor is in network, then a third platform to book that appointment, and if at all, maybe a 4th platform to understand how much it's going to cost. Here you just get it all in one place where you don't have to go anywhere else. It's all in one platform that is kind of like a health operating system.
Yeah, and that 4-call process, like in the past, is truly, like in my opinion, that's like calling like anybody from the 1960s to 1988.
Right.
And like your buying experience is going to range somewhere in that horrible experience and may end up with a fax somewhere.
Yeah, and it's also interesting that transparency, right? Pricing. Like I looked before I came here, I looked how many MRIs are in 50 miles from this studio. There's about 271 MRI locations around this studio in 50 miles radius. Prices ranges from $193 to $3,500. That's the range of the MRI. And, it's a huge range. The average is about $2,000. But we as consumers, we have no clue. We just go either where our doctor tells us or what's the closest place. But literally you can have 2 blocks radius an MRI that costs $300 and one that costs $800. And we don't know as consumers. And it's crazy. And that's part of what Zoe brings, that transparency. And it helps to steer you as a user to those locations that do not overcharge or overprice you.
And I think like when you look at that though, I mean that has direct impact on 2 things. One, the healthcare plan, and so one, especially for a self-funded employer, that has a direct impact on if somebody goes and does an MRI for $500 and the employee owns 10% of that, you're paying $450 as opposed to you're paying $1,800 on that $2,000 example, right?
That's
and the
exactly
other side of it is the employee. $50 to $200 is almost half your premium for a given month on average. When you start thinking about like what you're paying. So the ability to be able to identify that, and can they schedule through your app?
Yeah,
they can, right?
They can schedule. They can again think about it as a health operating system. Like it's like I talk about our iPhone, right? Or it has an operating system. We don't have to go anywhere else to do something on our phone. Why do we need to go to different systems to do stuff that are for our health? But yeah, for your example. Self-insured employers, definitely they get the savings from day one. But even fully insured ones, I mean, when they get time, like we're going to reduce their claims, right? Because their claims are not going to be for $2,000 MRI. They're going to be for $300 MRI.
And you and I have talked about this in the past, but when you see somebody who goes and does the pricing transparency in the tool, what are you seeing? Like, so you look at, like, I go in there as an employee and I get to, like, how far down do I scroll before I'm like, I'm good?
It's fascinating because everybody will do the filtering by price, same as we do in flights, right? Like when you look for a flight, you do nonstop and then you look at the price, right? So same thing, they'll do price. So they'll see back to our example, 270 locations to get an MRI, right? So I'll filter it by price. And then I won't even scroll down past probably the first 20 because we also show quality. So I'll just look for the ones that are maybe 5 miles away, high quality, low cost. So even if I look only at the top 20, right, that are the lowest cost ones, that average for those 20 is probably going to be 2 deviation points from the average, right? Like it's going to be like a $300 average versus a $2,000 average. So the user behavior is, and it's not surprising. We're looking for high quality, low cost providers, and that's what we're seeing.
Yeah, and I think it speaks to like the human element of, one, they see stars and they're like, 5 stars,
right?
This is good.
Yeah.
And, they're trained to buy like that. So it's amazing what happens when you put in like an antiquated buying process into what a buying process feels like for the 99.9% of the rest of the purchasing. But the ability to schedule, the ability to see what that's going to cost. And, where do you pull the data for the cost transparency? Because that's a good important part too.
Yeah, we work with other vendors that are basically providing us that data, and we use claims data. So we can look at 5 years back of what did that specific MRI location charge for an MRI under that negotiated pricing, under that network, and basically give you as close to as a price as we can. But even we see the trends. We see the MRIs that charge $200 and the ones that charge $2,000. That's not changing. So giving you that transparency goes a long way. And user behavior is user behavior. It's like in any other thing that we're doing, right? Like in Amazon and everywhere else, we're looking to lower our cost. And healthcare is a big cost of everyone's life.
And the other part of this that I find really interesting is all of these point solutions are just that, right? They attach to a plan and they're usable in a point. I think the thing that you guys have done differently was build out the decision support piece of this, which provides the front end. And we'll talk a little bit about like some of the back end stuff we've been working on. But on the front end, that decision support is another touch point. And that's the touch point when that's like the Super Bowl.
Yeah.
That's when every employee engages, is like at that open enrollment moment. And so what was the logic there? Like, how are you thinking about were you thinking about driving more membership into the plan to create more utilization and drive from there? Or what was the thought process on that?
Yeah, it's an interesting question because we like to think of ourselves as user obsessed. We're constantly thinking of ways to make the platform even better, make the user more engaged. And when we started building Zoe, we didn't really have an open enrollment or a decision support tool for open enrollment. But as we kept talking with users, they said, oh, this is great. But one of my biggest pain points is in December or November when I need to go through open enrollment. And I don't know which plan to pick. I have 3 to 12 plans that my employer provides. So we said, well, we're already analyzing these plans. This is such a huge part of the journey of a user. Why not just use Zoe to pick a plan? And what we did is we did exactly that. We built an open enrollment decision support tool where the user comes in and Zoe will look at 2 main factors. She will look at financials and coverage. She will help every user kind of understand for every plan that they have available, what is the cost, what are the deductibles, what are max out of pocket, which doctors you usually go see are covered under each plan, which is an important factor, right? People want to keep their OBGYN or their primary care physician. And then she'll build financial scenarios for you to understand that as a household, this is how much you're expected to spend on healthcare next year in different scenarios. Like best case, you're only doing annual checkups, or worst case, God forbid, there's something that is like a catastrophic event. Or you can just build projection and say, well, I'm thinking about having a baby next year, or I'm thinking about having surgery. So she'll tell you exactly how much it's going to cost under each plan for you and a spouse, you and your family members. So it really takes away that uncertainty of how do I pick a plan? Because in the research we did, we also talked to HRs, and obviously they want to help their employees pick the best plan. But some of them actually told us, well, I just tell my employees which plan I picked, right? And then that drives some behavior that's probably the wrong one. So you really want to give your employees the right tools to pick the best plan for them.
Yeah, and it's funny because historically that's been like an avatar,
yeah.
right? Like it's some avatar, which like from a buying experience, like I despise the idea of some cartoon and like some virtual reality telling me like what I should be doing as a grown up.
Yeah.
And that's part of what drew us to this. And, you know, a lot of the conversations, and I was going to save this towards the end, but I'll bring it in now, was around linking that to existing data.
Mm-hmm.
And so for us as Genesis, that's, you know, tying in our data warehouse to Healthee so we can use existing claim data. So instead of relying on an employee to give an honest answer into the system, we can actually provide the system with the data and they can use that. And I think that is where this goes from here. And it creates like a really real, like this was your last average 24 months or 12 months. This is what you did. And then going forward, I think the members not only choosing something that's based on historical data, and there's no predicting catastrophic events,
Right.
but I think generally what someone did last year is a very good indicator of what's going to happen next year.
Yeah.
And so as you build this out, is that something you see as part of the roadmap in the future on a broader basis?
100%. I mean, we understand that data is king, right? Like you want to use data to, like we keep saying back to the user obsessed. You also want to give the user a personalized experience. So you want to be able to tell them, hey, based on what we're seeing, you may want to go get this test, or you've used this many doctors or this type of doctors. This is a better plan for you. Or even, hey, I see that you have diabetes. I want to remind you that you need to get some kind of medication, right? Like personalization is always drives engagement, and I think it's what users are expecting, right? They don't want a kind of a Zoe that works the same for everybody. They want a Zoe that is personalized for them, their family members, and getting data and using data, leveraging that brings a much better experience.
It also maximizes their time.
Yeah.
Because you're not sitting there listening to a 12-minute video that's going to take you through this tutorial of all your benefits,
Right.
what they mean, tell you about a deductible. It's legitimately saying whether it's self-reported information or it's information that you're gathering via some sort of API or data dump. The reality is that information that employee gets is going to be real-time data that they can use based on some version of feedback or information flow, and they can make decisions in a much faster manner. I think,
Right.
What was the average time? You had told me and I totally forgot, so that's on me.
Of what?
Like the average time it takes for an employee to go through, the Healthee process. Start to finish,
it's
in decision support.
Yeah, like the decision support is a matter of minutes, right? Like you go in, and it really depends on how deep you want to go, because there's many places you can go in the platform. But even the decision support, the data is right there. Like the onboarding process is less than a minute, and then it's up to you on how much you want to spend in the platform and kind of like where you want to go. But you're right, like it has to be personalized. There won't be engagement. Like watching 12 minutes videos.
That's
I
worse.
mean, think about like today, like millennials, Gen Zs, they have they don't want to watch 12 minutes. Nobody wants to watch a 12-minute video. We're very focused on providing the user the information they actually need. If we show you data or information that you don't need, you just won't come back.
Yeah.
And our main KPI, the main metric that we look as a company is monthly active users, because we understand that if we have, the more users we have, the more we can affect their health and improve their health, right? And if they don't come back to the platform, that means that either we don't provide enough value or that we can't really affect their health. So that's something we're constantly looking at, how to create that engagement. And we're seeing so far amazing engagement numbers.
Yeah, what does that look like?
So even without the decision support, we're at like 40% enrollment, which is 5x than the benchmark. If we do the decision support during open enrollment, we get to 80-90%.
Yeah, and it's funny because when I think of open enrollment, right, like if we hit 40% of the people stay awake in the meeting, right, like that's a win. So I just think of those meetings, like when you think of corporate time and like where this has gone, but we've evolved a little bit from like the printed benefit summaries. We're using QR codes and stuff like that, which is super helpful. And that's like, step one in automating some of this. But then it's really, you start looking at, eliminating those open enrollment meetings where you lose hours of days for employees who came off the line, who came out of their offices, who had to sit through a meeting that they didn't want to be at and were on their iPhone and were checking their, something else and shooting emails that weren't listening to what we were teaching them. And then I think of my staff selfishly as a consultant that is out there delivering this message, prepping the meeting, building the presentations, finalizing the guides. And they go out there and we're losing hours of production because they're doing that. And while the whole goal of that is to create communication. It's just a highly inefficient way for anybody to digest data in a way that nobody really wants it.
And it hasn't changed for years, right? Like we're still doing the same meetings, and this is not how people consume data today.
Yeah.
They want to consume it at their time when they're available to consume it. They want to consume it not in a 30 minutes or a 1 hour meeting, and they want it on their phone available when they want it, bite size. And that's exactly what we're doing.
Yeah, and it's funny because I think the major change in all of that over the last 25 years was that at some point it moved into a Ben admin system, and that data was transferred, via file feed. And that's the extent of it, right? Like before that, it was a data collected and aggregated into a census by some poor HR employee that was sitting there with the worst job on the planet to key in all that data. And then that data was then passed to the carriers. So, I mean, like, or it was faxed.
Yeah.
And that all happened in, our career time.
Yeah, that's right. Yeah.
And that like upwards of like up to 5 years ago, and in small group, it's still happening. So I think it's a really scary thing to say those were the monumental changes. And you start seeing something like this come down the pipe that provides such an avenue into real industry change, and touching it on the decision support is one aspect for the employee, but then again, kind of migrating it back to the tool then lives for the employees to start doing research on existing claims. It's two very real use cases on this.
And I'll give you another angle, right? Like another thing that hasn't changed is how do we decide which benefits our employees needs?
Yeah.
Right? We either look at claims data, which only gives us the data on benefits they're already covered for, or we try to do like a survey or ask them, right? But one thing that we do is we actually capture every question an employee asks, obviously anonymously in an aggregated way, but we can provide our employers kind of a dashboard that says, hey, these are the benefits your employees are asking about. They're asking about mental health. They're asking about things that you may not be covering. And until now, there was I was in a meeting the other day with an HR representative that said, hey, we just added acupuncture. And I said, oh, how did you decide that you want to add acupuncture? And they said, well, somebody said it in a meeting. And that was it. There's no data behind it, right? And to be able to provide actual data on what employees' needs are is also game-changing because we haven't done this before. And it's also meaning that we need to educate HR leaders on what that data actually means. Like, what does it mean that many of my employees are asking about mental health? Does it mean that I need to add benefits? Maybe I need to actually do more campaigns about the benefits that I already have. Like, there's a lot of new data that we are now surfacing that it hasn't been there before.
And so how are you capturing that? Is that if I go in and search, like, I have I feel depressed.
Yeah.
Right, in the engine. Is that where you're capturing it, or is there other places
as
well?
It's if you go and, like, because you don't have to ask. You can also, there's benefits galleries where you can go and click or hover above benefits. So we'll see that. We'll capture basically anything that happens in the platform, again, in an anonymous way, in an aggregated way, to provide the employer the best data that we can give them to kind of like affect their benefit strategy.
Yeah. I truly love that, because I think that's one of the challenges is trying to figure out which point solutions make sense, right? Yeah. And on top of that, you have a lot of, and this exists really in the tech world. When I was in my last role, I probably had 300 tech-based clients, and through, New York, Austin, and Silicon Valley. And like the amount of tech point solutions that were just being dropped on the employees was like unmanageable. It's unwieldy in what you're trying to aggregate and what you're trying to accomplish. And each one is like, and this is why I find Healthee to be such an interesting solution to me, is that you're able to have multiple touch points through the process, whereas most of those point solutions just solve one point. There's one for diabetes, there's one for smoking cessation, there's one for this. And at the end of the day, it's like books on a shelf. And I think it's really hard to follow.
Yeah, I'll give you two examples, right? One, I was talking to an HR leader of a large company, and they said, I don't even remember which point solutions we have. When employees come
on the microphone.
When employees come to me, I don't even remember what we have. And another HR said, well, this is the time where we're trying to save money, so I have 20 point solutions. I need to cut them in half, and I don't even know which one of them employees really need and what the usage is. So for us, it's also that's another thing that we added after we started the platform. We said, okay, let's bring all point solutions into one place, because we realized, again, being user obsessed, that users don't know what point solutions they have. So we put it all front and center. And if somebody will ask about, like you said, if they're depressed, it's not only what they have from their insurance, it's also what they have as a point solution.
Yeah, do they have ginger? Do they have another solution? Yeah.
Right? And it's all there and it's all available. I mean, obviously we can increase utilization of point solutions, but we also just bring it to the employee and make sure that they are aware of it.
And I think that comes back to the ROI discussion, right? Because I look at point solutions as apps on your phone.
Yeah.
You're paying for all of them. And it's like death by a thousand cuts with the different PPMs that like each one of those incur.
Right.
And I think from a CEO or CFO perspective, when you start looking at like what's my budget in our healthcare and employee benefit spend, a big piece of that is a lot of that's baked in, some of it's not, but you start looking at like, all right, if we have 20 point solutions, that's probably $80 to $120 PPM that you're spending in addition to your medical claim costs, your admin, and all that stuff. So that adds up fast. And if you have 1,000 lives, that's a lot of dollars that you're attaching to your expense that may or may not be necessary.
Exactly. And if you have 1,000 lives, you're probably spending anywhere between $5 to $15 million a year on healthcare. And what is the ROI that you're getting from all these point solutions? You have no clue. And what we talk a lot about, and it's interesting you brought it up, because the CFO discussion is more and more relevant because CFOs now, I think, have a much bigger seat at the table when it comes to benefits and health benefits, especially because it's such a huge expense. It's sometimes your second or third biggest expense of the company. And we like to talk about ROI because it's important. Like obviously, we want to make employees healthier, but we also want to help them save money. Back to the MRI example. Let's see that's a saving right there, right? But there's also what I like to talk about, and we talked about, is the cost of doing nothing, right? Like if you don't help them to find lower cost options, your expenses are just going to grow and grow, right? Like in the next 5 years, your health expenses may grow anywhere between 40 to 60% if you don't do anything to kind of help mitigate that.
And I think this allows for different solutions, right? Like, so what we look at is, and there's a lot of talk about like reference-based pricing in the market.
Right.
And I'm not a huge fan of it.
Yeah.
I don't believe in, driving a car off the lot, then calling the dealer and saying like, this is what I'm paying you, and the car's never coming back.
Right.
I just feel like there's an ethical component, and there's a piece of this with the hospitals where they're just going to stop accepting it.
Right.
But there are ways to, whether it's going with an immediate pay reimbursement, there are like whether it's creating a narrow network, which we can do in a solution like Healthee, because we can bubble up the more affordable hospital options.
Exactly.
For employees. And realistically, as long as it's high quality and it's convenient, living in Manhattan, if something came up and you showed me NYU or New York Presbyterian were both cost effective and preferred options, I would have no problem with that.
Exactly. And that's where the whole steerage comes in, right? Like you want to steer employees to high quality, but still low cost options, right? Or preferred option. And that's exactly what we do because we can show those options first. We can steer employees to the right direction and make sure that you have all these great options for them, but sometimes they just get lost in all the options that they have, right? So we can make sure that they're showing up first, that we're steering them there. Exactly.
Yeah, and I think it's trying to get this stuff, out of this, like not lost in the sauce, but out of the sauce, right? Like how can we single this out and show it in simplifying the buying process? And no employee instinctually wants to pay more. They may not take the cheapest MRI, but they're definitely going to, like, if it's between, 150 and 2,000, they're going to live in the 350 to 650 range.
Exactly. And I don't think anybody should take the cheapest. They should take the highest quality one.
Correct.
But you can see from our data that sometimes even higher quality doesn't mean higher cost, right? Like, higher cost doesn't mean higher quality.
Yeah.
So you see that there's like low quality options that are really expensive. So there's always, from our experience, there's always an option that is maybe not the cheapest, but at least it's like, in the 25 percentile of like lowest cost with high quality. And that's where you should go. Because as an employee, yes, you want to go to a high quality place, but you also want to save money. Yeah.
And like we said, like the next step in that is being able to then start steering people via narrow networks and that type of stuff. And that's where this becomes at least more even further into the ROI discussion and being able to integrate like the centers of excellence and all those other things that come with, especially being self-funded, which makes this really interesting.
Exactly.
So let me ask you this, like, without saying like, where do you want to be in 5 years and give me like the bullshit interview question, but like, see, like, what's the roadmap? Like, where do you see this going from here? Because there's a lot of other touch points you probably can impact, but I'd love to see like your thoughts on where you take it and then, what you're hoping for that to look like in the future.
So I think when you think about our platform, it's constantly evolving and adding features. And again, when you build an operating system, like a health operating system, there's always things that you add. We just added, for example, a telehealth option. So you can use telehealth through our platform without going to anywhere else through a partnership that we have. We're adding a way for you to deal with billing, right? If you get a bill that you're not sure what it is, we want you to be able to upload it to Healthee, and then we can tell you, hey, is there a wrong bill here, or there's a mistake here, right?
Yep.
So we're constantly adding features. I always like to talk about the sprints. So we have 3-week sprints where our development team will pick a feature and just go and try to bring it to market as fast as we can, which means that our partners or our customers, they keep getting updates of the platform with new features. We're also working on adding medications now. There's many things that we have. So when you think about roadmap, we're really trying to enhance the solution. We enhanced it a bit this year to open enrollment. We want to enhance it to billing and claims. But when you say, okay, in 5 years, I want to touch as many lives as we can. I want to help as many employees be healthier as we can. I want to become the number one navigation platform out there, because I think today we're the only navigation platform that is an all-encompassing one, that you don't have to bring any other kind of parts of the puzzle. We bring it all in one place. So as we grow, I want to become the biggest navigation platform out there.
Yeah, I love that. And the navigation piece of this will has so much room.
Exactly.
There's so many different things. So when you say medications, that's going to be, I get prescribed some medication. I could put that into the search, or would that integrate? What would that look like?
So we're still building that, but I want you to be able to tell me, hey, this is the prescription I got, and I'll be able to tell you, are you covered for it, how much it's going to cost you, and where you can go get it.
And would you be able to tell me where that falls on the formulary? So it'd be, you know, this is tier 3, so it's going to cost me. It'd show this is going to be a $60 copayment, or, you know, 30% up to $300, and then would it also at some point do you envision that also providing generic alternatives or?
So it's actually we're looking at generic. I think it's actually something we're seeing that is not that complicated to do through partnerships. So yeah, it's something that we want to do, but obviously we need to remind you that it's not going to go into your deductibles and stuff like that.
Yeah. But I think someone's going to be like, if I have this tier 3 drug, you know, I get the, you know, and I can get an alternative for less.
Right.
And even though it's not going to accrue, it's going to cost me, you know, $4 out of pocket.
Exactly.
I feel like that's a win.
Yeah, and it is that, right? Like we'll see, because we already started some testing. It's $4 not accrued to the deductibles versus $40 or $50, right?
Yeah.
Like even more.
Which accrues, but at the end of the day, I'd rather just keep accruing
Exactly,
$4 and not have that go.
Right.
You know, that's 10 scripts before I have to even care.
Before you even get there.
So I think that's, and I guess, you know, in that, is there, you know, one of the things we have talked about was also on the back end adding, you know, the Genesis, you know, back end audits.
Yeah.
So we can do retrospective audits through the system integrated with our data warehouse. And not only can we identify employer dollars and savings that come back into the organization to the tune of about 5% per year over the 3-year audit period. Yeah. We can also discover dollars for the employees.
Exactly.
And that, like, those reimbursable dollars will be reimbursed quarterly, and we can show that amount in the app. So it's another touch point that we're looking to build.
It's another touch point, it's another engagement. Like, again, going back to, I want the employees to only have one place where they go for anything to their healthcare. That's including that. Hey, you have a refund, or you have some money that you spent that you shouldn't have. Come back to Zoe and she'll show you exactly how to get it.
Do you see a place where you build out, like, you know, whether it's integration with the carriers? And I know that's like I mean, that's just like, you know, that's not the equivalent of landing on Mars, but it's definitely like getting to the moon.
Yeah.
But like, is there something there, or, you know, even beyond that, is it just like, hey, we're going to start storing your ID card here? So it even like it's another touch point. So whether it's getting a virtual card or.
So actually, that's our next feature. We already have, we're going to have an ability.
You didn't even consult me.
Yeah, it's a surprise. But we are working on having a virtual ID card. It's probably going to be before the end of the quarter. But it's something that we are doing.
Because the member ID and the group number and you know a few other data points is really all the provider care about. So if, like, they can show it and say, like, here it is.
Exactly. They can show it. They can show it on their phone. They don't have like to have an actual physical card. So yeah.
Yeah, and you know what I love about Zoe compared to other features that may or may not be named Alex, right, that are out there, is that, you know, this is something that's going to be with me on the journey, you know, over the course of, you know, 10 of 12 months or close to 12 months, versus that's a solution that if I engage with it, which is probably, you know, at a 10% engagement rate at best to begin with, if I engage with that, you know, I'm not thinking about that again until the following November or the following October, whatever my open enrollment is.
I think that's like almost the definition of a point solution. It's only like in one point in time, whereas Zoe's always there, because Zoe's not just for you, it's for you, your spouse, your dependents. So our engagement with Zoe is constant, because there's always something that you need, right? Even if you don't know that you need, she'll remind you. Or it's you know, Mental Health Awareness Month. Hey, maybe Zoe will remind you that you're covered for mental health benefits. It's always there, not just open enrollment.
And is that one of the features too? And forgive my, you know, ignorance to that, but like, you know, push notifications for specific things like that. Exactly. As an employer, I could push out notifications through the app, right? I can say, like, did you know you have this? You know, check your benefits here, or
exactly. And it's going to be also like personalized notification. I asked Zoe about back pains, and now my employer added a benefit around acupuncture. She will tell me, hey, you asked about back pains 2 months ago. Now there's a new benefit for back pains. So those notifications are, yes, they are like the ones that goes to everybody, but there's also ones that are more personalized.
Yeah, and that's kind of gets back to the herding cat philosophy of trying to get everybody to do something. And honestly, I look at like healthcare as a one-by-one thing. And what I mean by that is, you know, you can get the notification on the acupuncture, but like, you know, in most cases, you just never knew who to reach out to. You just knew like there's some demand for this. So being able to use an artificial intelligence to drive people based on behavior, based on questions, based on what you're seeing. Yeah. And I think down the line, there's also, you know, based on the questions and the migration that you can see based on the support that you have, there's some predictive modeling we can do when it comes to plan design information and how we're going to customize plans going forward. You know, that's outside of the actuarial realm, right? Which is like, if you change by $75, we anticipate 6% of the population is going to go to this plan. I think there's more art. There's a lot of science to that based on the math, but I think there's a lot of art that can be backed into that as well.
I agree. And I think we're now just learning how much data we can actually get out of Zoe. And it's amazing because we have not even uncovered everything that we get from that data. Like, we have the data, but we're now trying to figure out, okay, what does that actually mean? Like, what is the so what of this data, right?
Yeah. And that matters because that's so what right now is just like, it's anecdotal, it's gut, it's feel, coupled with, historical actuarial math that's going to say, like, if we do X, Y will happen. Right. And that algorithm isn't bad. We're pretty accurate with that when we do it for our clients. The challenge is it doesn't take into account any of the socioeconomic demands that exist within, a population. It's just like, realistically, if we do X, Y will happen. Yeah. And there's more to it than that.
It's based more on experience, right? Like, and what you're seeing. And I agree. And this is data that we can now leverage.
And now, are you guys measuring, I think, the NPS scores for employees yet? Is that coming?
That's coming as well. We are seeing, really amazing feedback so far. And some employees will think Zoe is a real person and they'll send thank you. But we are working on putting an NPS. We're also measuring our implementation process, which is super straightforward from the employer side. There's almost, it's a very minimal lift, but we want to measure that as well. So we're adding ways to measure every part of the process.
I love that. And let me ask you this, just because, I've worked with a number of McKinsey alumni. How has, building something, where you looked at efficiency on a day-to-day basis, how has that helped you build this to be more efficient? And I think the sprints are a good example of that, but I'd love to get your thoughts.
So we're measuring everything in the company. Everything. There's not a single thing that we're not measuring. We have, obviously, OKRs, where we have one, which is the monthly active users, and everything is kind of like from that. But I can't even think of one thing that we're not measuring. We're measuring, how many plans we have in the pipeline, how many have we analyzed, how many users have used the platform, how often did Zoe, for example, didn't know what to answer, and then it got escalated to a live benefit experts. So for me, as McKinsey, we did that with our customers, right? And we're doing that today, where we're constantly looking on ways to improve and what are the processes that we have today that we can improve and get even better. But everything is data-driven. Every conversation we have with every one of our department leaders is less of I feel, it's more of I see in the data, and this is what I'm going to do.
It's funny because that's why I think when we started meeting, that was where I really align with you because, one of our core tenets was data-driven. One of our, we say, we're essentially using the same term as like client obsessed. But I think the part that really impressed me was because of the back end measurement that you use, which is why I asked the question. It speaks to how thoughtful you are in what you're building. Yeah. Right. And I know, the goal for how can we eliminate the amount of calls that hit the call center because we can answer that within the system. Yeah. And there'll be some set, but how can we shrink that? Right. And that creates the repeated experience within the app. And that to me is something that impressed me when we met. And I love what you guys are building with that.
Thank you.
So we're really excited to be partnering with you. I love this product, and I think this is going to make a massive difference. And I'm excited to be working with you through the process. And I truly appreciate you making the time to do this today.
No, this is great. And I'll just say we're excited as well. I think we're always looking for forward-looking kind of like partners, and that's exactly what got us excited about partnering with Genesis.
Yeah,
as well.
I'm gonna take that clip, cut it, and send it to my mom, just so she knows. Like, I'm not down here on the streets. Yeah. But we really appreciate it. This was fantastic. Yeah, thank you for doing this, and I know you're heading to Dallas later, so have a safe trip.
Thank you. Thanks for having me.
Thank you.
Yeah.
Get more out of your benefits when you connect with Genesis Health on LinkedIn or through our website, www.genesis.health. And be sure to subscribe to the Benefit Summary wherever you get your podcasts. That way you don't miss the benefit of future episodes. This has been the Benefit Summary, presented by your friends at Genesis Health.